Good morning. Uh, my name is Elkhammas. I'm professor of clinical surgery at the Ohio State University, Columbus, Ohio. My main interest is liver, kidney, pancreas transplant, as well as vascular access and ethics. Today, I'm going to talk to you about humanism and medicine. It is a short presentation, just introduction to really what I mean by that. So what I'm going to do, I'm going to share two patients' real stories with you, and then some comments about humanism and what it is. And it should be a short and sweet presentation, I hope. So let's start with the first story. It's a 51-year-old athletic female who was complaining of hip pain. It has been chronic really for weeks and weeks. It's becoming intolerable for her. It was recommended for her by her family doctor to see an orthopedic surgeon because it seems she's getting at a stage probably where she will need a hip replacement. She came, she saw the surgeon. The whole time she was really overwhelmed. She's very young. She was told that she needs hip replacement. She was crying the whole time. And the doctor basically, he was just talking about what it takes to replace the hip and the pain and the post-operative management and complications and so on. He really did not take time to deal with her as a person, so she felt that she was just simply a number in his clinic. He did not really make any connection with her, and of course she left the clinic quite unhappy. And she searched on her own and found another surgeon where she had her surgery and things got better since. The other story is also from within the medical field, actually. The patient was a 57-year-old physician who was diagnosed with a metastatic salivary gland tumor. And even though he was 57, he was very active, clinical research. He was an academic surgeon. He was active in the affairs of the medical center and so on. He underwent surgical resection and was told that he probably should have chemotherapy and followed by radiation. Okay, so he contacted the oncologist that he referred to, and instead of getting an appointment, the oncologist actually called him over the phone. And the following conversation happened. He said, "Oh, sir, your tumor is very rare and there are not enough cases to have a standard of care. I would not do anything. I would not give you chemotherapy, and I will just wait and see what happened with you." That was the end of it. The physician was hoping that as a courtesy, his colleague will, invite him for a visit, but it seems the oncologist has a different opinion. He didn't invite him for a visit. He actually told him, "No, you don't need to see me in the office, and no meeting is needed, and no empathy, nothing." In any case, as expected, since nothing have happened, and did not show any empathy, did not invite him to see him in the clinic, or at least see him in his office to have a chat about the situation. And so the patient got a second opinion and was able to get the chemotherapy and he is alive and well, but was really very disappointed with his colleague. So basically, those two stories showed us that the doctors were really qualified. I mean, whether the orthopedic surgeon or the oncologist, they were fine. They have the skills, they have the knowledge. But there was a missing factor. They could not connect with their patients. They did not get the trust of their patients. That's on one hand. On the other hand, the patients themselves were looking for that factor, missing factor. They were looking for the doctor to connect with them, to have empathy with them, to be sensitive, to deal with their stress and so on. So, and that is the factor, what we call it, the humanism factor. And it seems it can make a difference. A humanism. What is a humanism, really? To be honest with you, it's probably very simple, but there are many sentences will lead to the same meaning. So I'll try to read them in different ways, and hopefully at the end you will get the picture. So a humanism, in one way, you direct your thoughts to the human and not anything else. So you're not talking about religion or divine or superpower or anything. It is to that human. You put the importance to the human needs. That's another way of defining it. You could say it is philosophy of life that leads to ethical behavior based on the human importance, not the religious beliefs. In another way, basically you focus on the dignity of the human being and the many choices he could have in his life. I hope you're getting an idea what a humanism means. So, if we take those previous definition or sentences that represent a humanism in general, and you apply it to humanism in medicine, then what we say? We say probably it meant that devotion to humanity as part of your medical service or your care for your patients, or your behavior should emphasize the value of the human being, the value of your patient. And actually it is probably, we have it. I think in every culture, all we have some humanism in us. So what you probably end saying, if you're practicing a humanistic medicine, you may say that life, all lives matter. So now you may also you go back to the Hippocratic Oath or any oath that came after that, in different cultures, different religions. They do agree on a few things together. So take the religious part out of that oath. All oaths from the beginning, from the Hippocratic Oath until today, they agree to put patients' interest first. Put patients' interest first. That's really extremely important. And now if you do that, it can really give you a push and connect you with your patients, no doubt about it. Is it really specialty specific or sector specific or cultural specific? No, humanism is really every culture appreciate that part. So all the specialties, all the professions, I mean, whether it's a physician or a nurse, or it's actually the leadership should be humanistic too, dealing with their employees, dealing with colleagues, and so on. There is a study that was published in JAMA many years ago, actually looked at malpractice suits where patients who are unhappy or their families, and they sue doctors, they take them to court, and they try to get them punished one way or the other, either financial gain or they get the doctor license revoked, or in any way. So 45 cases were examined, and 71% of them turn out that the problem was really a relationship between the physician and the patient and patient's family. And most of them, they say, oh, the main issue is devaluing patients and family views, not respecting them, and not giving them enough information, delivering poor information. So, why they are suing again? Because lack of caring and empathy, lack of connection, lack of building good relations with patients. That's another really conclusion from the article. I think I'm going to stop there, and we'll finish later.